When you or someone you love is in need of home health care services, it can be a daunting process to find just the right provider. Will their teams be a good fit? Will my health insurance or Medicare cover the cost? Well, since 1985, OhioHealth Home Care has been a trusted provider of home health services. It's also received the Consumer's Choice Award, which is given based on independent customer surveys and reviews. Joining me to share more is Mindy Sanford with the OhioHealth Home Care. Nice to have you, Mindy.
Thank you so much for having me.
And I know we want to point out that this is your name now, but you really have changed names, so people might be familiar with you and not even know it.
That's correct. Our name was Home Reach up until about a year and a half ago, and we did switch that to be OhioHealth Home Care. We thought it more accurately reflected what we do, and we also wanted to recognize the fact that we are a part of OhioHealth.
And the fact that you do a lot. I mean, you have some umbrella services. So can you kind of outline what you mean by home care?
Absolutely. We have actually 4 different areas that we cover. We provide medical equipment in the home and respiratory equipment such as oxygen, CPAP equipment, beds, walkers, and wheelchairs. We provide infusion medication for patients who may receive their infusion therapy in the home, and then we provide skilled home health and hospice services.
A lot of services. Home care can mean a lot of different things too, can't it, Mindy? I mean, when people think home care, they think someone coming into the home to help with daily, bathing sometimes, or helping with food and medication. But it can also be for someone who just is ill or in an accident and they need somebody on a short-term basis.
That's exactly right. And with the home health services specifically, that is a skilled service. And what that means is it is an order given by a physician, and we have clinicians such as therapists and nurses who come into the home to help these patients.
Do you think patients do better being able to stay in their home and having someone come to their home to do this sort of rehabilitation as opposed to going to a center?
Absolutely. Patients want to be in their own home. Individuals want to be at home with their loved ones or their pets, being able to get around and do the things that they want to do naturally. And so being able to come into the home with our clinicians and help that individual to become more independent so they can remain at home is one of our key goals.
Hospice is also something that is under that home care umbrella. And Cobacker House is, well, that's a name that everyone associates with the ultimate and wonderful hospice care. And you've expanded, I know, recently too, because there's a need.
We have. Our Cobacker House now has 24 beds. It can also accommodate families to stay with the patients as well. Very serene. It's on Ted Wooded Acres behind Riverside Hospital. And it's a great place for those patients who need a higher level of care for a short period of time. So it is a great supplement to our normal hospice services, which are provided in the home, wherever the home is for the patient. It may be their home, a nursing home, or assisted living.
When you say families too, what's there and how do you provide for the families?
There actually is an area where they can have a pull-out couch so they can actually stay in the room with the person. We have a full kitchen and a lot of wooded areas. The families can take walks. We are able to also take the patients out of their rooms. There are patios that the patients can roll their bed out onto the patio if the weather's nice and the family can join them.
It is beautiful. We saw some pictures of the campus, and it is a wonderful place for these families and the person who is in hospice. Back to home care for a minute, and we're talking about people trying to stay in their homes. Are you seeing that more and more as a trend too? Families trying to keep their loved one either independent or at least not having to leave their home for full assistance?
I think so. We are seeing a lot more of that. There's a lot more services out there to help to keep the patients in the home, such as home care, to be able to work with the skilled patients specifically. I know within our team, we have specialized clinicians to deal with the different types of conditions that a patient may have. So for example, if you're someone with a heart condition or a respiratory condition, we have a specialized team of individuals that deal specifically with that type of condition. We use different resources, electronic devices to measure the vital signs, where information is transmitted via the web back to a nurse in the office, and they can monitor those vital signs and those kind of things that are specialized for that condition. So we have different teams of people that can take care of those patients.
And all under the OhioHealth umbrella, which has got to be beneficial to the patients.
Absolutely.
Because all of those services you talked about are all there. If someone needs that assistance, how do they go about starting to get it then, Mindy?
Well, they can always talk to their physician about any of the services that we do have. We are also on the web under the OhioHealth website, ohiohealth.com/home care, or you could reach us at 1-614-566-0855.
We've had all that information on screen too, Mindy. So hopefully if there's a family that needs to start that process, and I know it can be a process, it's probably time to start.
Absolutely. We're here to help.
Thanks, Mindy. Nice to have you.
Thank you very much.